Okay, in this video, we'll be doing the postpartum assessment, and which includes the bubble heat, checking the lochia, and the uterine fundus. Okay, so the first thing you want to do, you want to when you enter the room, you want to introduce yourself. You want to wash your hands. You want to put on gloves. You want to check the patient's identity with name and date of birth. You want to do, the first thing you want to do is your general assessment. You want to assess the patient, how the patient is talking, if the patient is alert and oriented. You want to check for postpartum depression, see if the patient is experiencing postpartum depression. You want to see how the patient is interacting with the baby. Is she, having good eye contact with the baby? Basically how she's handling the baby. Okay, so you want to explain the procedure that you're going to be doing and the things that you're going to be doing with the patient to make sure the patient understand the procedure. So the first thing you want to do, you want to check the lung sounds to make sure that the lung sounds are clear. Then the next thing you want to do, you want to check the patient's heart sounds. Make sure that the heart sounds good. After you check the lung sounds and the heart sounds, the next thing you want to do, you want to go down to the abdomen. First, you want to look at the abdomen, assess the abdomen by looking at it, make sure that things look normal. Also, before you get started with assessing the abdomen, if the patient needs to use the bathroom or the patient has to use the bathroom within the hour, you want to see if the patient needs to use the bathroom. Okay, the patient, don't need to use the bathroom, then you could continue with your thing. You want to have the patient laying down and go into the abdomen. So you want to listen to the bowel sounds, starting in the right lower quadrant and going around, and you're looking forward to see the patient's bowel sounds should be hypoactive after delivery. Once you listen to the bowel sounds, then you want to go into checking the uterine fundus. Okay, so we're checking that. You want to support the I don't have anything to really. You want to support the uterus with your hand, and you want to measure it with finger breaths. So the uterus should feel firm. So with one finger at the top of the uterus, you do one finger at the top of the uterus, and as you go down, that's how you determine the finger breaths. Anything under the top of where you feel the uterus. If the uterus feels boggy, you want to massage the uterus, and as you're doing that, you also want to examine to look for clots, and with if it feels boggy, you want to make sure you check the lochia. You're going to check the lochia as well, but especially if it's feeling boggy. If the uterus is deviated, you want to the patient may have to use the bathroom. That's why I say check to see if the patient has to use the bathroom at first, because then you won't have that problem if you know your patient's already used the bathroom and everything. So like I said, if it's deviated, it's if the patient haven't used the bathroom, the patient might have a full bladder. Okay, so now that you check the uterine fundus, when you're doing the finger breaths, that's when you're checking the location of the uterus. I didn't explain it. Okay, so when it comes to voiding, you want to ask questions about the voiding. If the patient had any urgency, if the patient's having any problem voiding, if the patient has any hesitation or any pain with voiding. And then you want to go and you want to check the lochia. So when checking the lochia, you want to you're basically checking the bleeding like a period. You wanna check the period pad that's under it. If the patient is having heavy bleeding, then you want to make sure you change the patient's period pad. But you're looking for rubra, which occurs 1 to 3 days after. And then you have serosa, which is 4 to 10 days, which it'll be like a light pink. And then you have alba, which is 10 days or more, it'll appear clear or white. You also want to check for any discharge, check for any clots. Okay, then you want to check for a episiotomy, and you're looking for Rita, and Rita is redness, ecchymosis, redness, ecchymosis. Is it one E or two E's? Rita, redness, ecchymosis, drainage, and occlusion. How to check this? You want to have the patient lift the buttocks, and you want to check for tearing. Usually, the patient will be sutured. That's how you determine the occlusion. It's like the tearing. So if it's sutured, then it'll be together, and you won't have the occlusion. Also, if the patient needs to be iced at this time, you can ice the patient. When you're doing icing, you want to do 15 minutes on, 45 minutes off. You want to do this every 24 hours. Once you check that, then you're done with the abdomen area. The next thing you want to check is the next thing you want to check is, I'm sorry, my eye is like itching. The next thing you want to check is for hemorrhoids. So you want to lay the patient either on the left side or the right side, whichever is comfortable for the patient. And you want to check the area for the anal area for hemorrhoids, which can be common after you have the baby. Once you check that, you want to check the extremities. You want to check for any edema in the legs. You want to palpate the calves to see if any tenderness. You want to have the patient dorsiflex the foot to check for any tenderness or pain under the kneecap. You also want to check for the peripheral pulses. And once you check the peripheral pulses, then that will conclude your assessment. And you want to, if the patient needs cleaning up, you want to do perineal care and change the pad for heavy bleeding. You want to See if the patient need anything. Trying to make sure I remembered everything. See if the patient needed anything. You want to clean up your supplies, help the patient get comfortable, make sure the patient's call light and everything is in place. You want to down your gloves and wash your hands. And that conclude this video.